A one, a two, a one, two, three. Let's go. Airy, tell us a little bit about you. Where did you go to school?
I went to Tufts University School of Dental Medicine. I recently graduated this year.
The
May
best
of
dental school in the world.
2020. Yes, it's the very best.
So tell us about Tufts. Tell us your Tufts experience. What's good about Tufts? What has been great for you?
Well, uh, okay, so our class size is about over 200 students. So in that aspect, you have like so many like different people that are gathered from all over the country, at our school. So we're very diverse. Um, so that's really cool because you get to be like, you get to hear about different cultures and whatnot. Um, as the school itself, the faculty members are also all over, actually from all over the world. And there's some of the like best clinicians. So you get like all kinds of input in terms of like getting prepared clinically. The first 2 years are didactics, and then the last 2 years are clinical. And then we'll have some classes sprinkled in third year.
Do you feel pretty prepared, like doing endos, oral surgeries, procedure-wise? Did Tufts prepare you well?
I feel like Tufts did prepare me well. In terms of endo, it could be better. Endo is always kind of hard to find. I was very fortunate to do two endos on my externship, as well as three. It was actually a molar, three canals for like in school. So I mean, if you think about it, five canals isn't much, and that's our requirement. And towards the end, if you don't have five, they'll kind of give you some wiggle room to like either write a paper or like do something else. I think like to do it on like a type it on tooth, because it is hard to find patients who do want to proceed with doing endo. But in terms of like crown preps, fillings, extractions, I learned more like on my externship in Arizona. I had the honor of going to the Winslow to work with the Navajo Native American population. So we did a lot of extractions there, and I think that's where I became proficient. Because at Tufts, you only do like I think 15 extractions, so that's really not that many. And the oral surgery residents help you if you need it, and you still get the credit for it.
It seems like you enjoyed the externship very much. Tell us a little bit about the externship.
The externship. So, as a Tufts fourth year, you have to do a 5-week externship, and it's kind of like a lottery system. So you kind of like this thing called the Oasis opens up, and you put in your top picks and you rank, and then they pick you like randomly. And if like you're, I guess, like top of the line, you get what you want. But if you're like at the bottom of the barrel, you kind of like don't get what you want. But I picked like so many dates for Winslow because I really wanted Winslow, and I got it. And so I ended up going between November to December last year, which was like perfect timing because we had winter break right afterwards. So it was like a very long break for me. And then I went back to clinic and I was like, oh my God, do I even know dentistry anymore? But I did. It comes back pretty quickly. But yeah, extra show was great. It's the Winslow Indian Health uh, Care Center, something. I believe that's it. And they have their own dental clinic. Everything's new, like very like up to date with everything. They have a CBCT, panoramic X-ray, like the whole 9 yards. And they even do ortho there as well. But obviously, we don't get to do ortho as like the extern like students. But we did a lot of fillings, extractions, pulpectomies, pulpotomies, root canals for me. So it was a lot of experience, and there was a lot of patients every day. At school we only see three patients max because we have like 3 hour like time increments, 2.5 at the end of the day. So three patients like for a whole day is not much. But there we saw like up to like I believe like 15 patients sometimes, depending on like if you're just seeing them for a new patient exam or not. But it really got me like faster in terms of like doing procedures and getting through exams.
So now dental school's over. You got your training. So tell us, what was it like finding your first job?
So I am a planner, and I like to have all my ducks lined up in a row before like I like decide to like, do anything. So 2 years prior to graduating, I started like job hunting and very slowly. I knew I wanted to work for a DSO. When I first started school, I wanted to do a GPR, but I've learned that the most important thing is mentorship. And Aspen Dental, who I work for now, I really like their model. I know like there's a lot of like misconceptions about DSOs. Like they're like, oh yeah, like the owner makes you dictate your treatment plan. Like they dictate your treatment plan. You have no autonomy. You have the restrictive covenant where if you like quit, like you can't practice within like a 5 mile radius or a 10 mile radius of that practice. Well, Aspen doesn't have any of that. And I'm not comfortable like having shackles around me like that. So that's what really enticed me to work for them. So I kind of worked with Aspen, and everything was still fresh. We just started opening up offices in the Dallas Fort Worth area, and I knew my fiance was gonna be here. So I told them, I was like, look, like I really want to work for y'all, but if it's not in the Dallas Fort Worth area, like it wouldn't work. Um, so uh, so we kept talking, and they got me to the right people, and I just went through like a interview process. Like they flew me down here. I talked to the regional manager, and then like a week later, I got an offer. So that was back in June of 2018, I believe. No, 2019. Yeah, 2019. So I had it lined up a year um, prior to graduating, like a little less than a year.
So we're very grateful to Aspen as well. They're one of the first DSOs that joined Dental Cupid, providing access to care to thousands of patients that would have otherwise ended up in the emergency room during the shutdown. But I want to ask you a little bit more about Aspen. One of the first things you mentioned is you knew early on you wanted to work for a DSO, despite having heard certain negativities about dental service organizations. How did you know you want to work for a DSO?
Well, like I said, I wanted to work for a GPR, or I wanted to do a GPR. I was dead set first year. I was very involved with ASDA, which is the American Student Dental Association, and that's what kind of got me exposed to like all these different DSOs. So like Aspen, Pacific, Heartland. And so like I was actually fundraising chair for as a District 1 my second year. So I really worked closely and like with these DSOs trying to raise funds for the district. So I really kind of like got talking to all the representatives, and like Aspen was the one that like really fell in line with me. And I like I mentioned before, like mentorship is very important to me. And I think like with GPR, I knew I would get mentorship, through more schooling, right? As well as experiences, and you're technically in school with a GPR. And then like DSOs, like I don't have anyone in my family that's a dentist. And I didn't have like a job lined up. So I was like, it's either private route or DSO. But then with DSO, it's kind of like a GPR. They kind of like throw you in there, give you a mentor, and just like get you going. And that's the type of person I am. You have to like put me in there, just throw me in there, give me some of the tools I need, and then just like kind of guide me, and then I'll be good to go. So I felt like it really lined up with my personality. And I thought that if I met the right people who would, guide me, I'd be in perfect line in terms of working for a DSO. It just felt right.
Tell us about your mentor. So you have a mentor currently at your where you serve. Am I correct? Tell me about him or her.
So my mentor is Dr. Ali, who is my practice owner. She's great. She actually graduated from Nova in 2018. So she's kind of fresh, but you can tell like when you work with her that she is very, very experienced. She like, it's insane. Like we'll be doing extractions together, and I'm still like fresh out of school. I thought I was really confident with extractions, but she's very gentle when in terms of extracting teeth. And I think she's trying to I'm a little more aggressive than her. So I really like the fact that like she's guiding me to be more gentle in terms of extracting teeth. And it kind of like made me, oh wow, like I need to like backtrack and like take it slow instead of thinking that, wow, I know how to do extractions, which I do in theory, but like I still need to work on my technique. But she's great. She's been guiding me with like selling treatment plans. And I know when you say selling treatment plans in DSOs, you're like, oh, do they push you to like just like get the patient to say yes, blah blah blah. But the thing is, we're not going to make a treatment plan that we don't think like is to the benefit of the patient. We're only going to provide a comprehensive treatment plan that we think is going to benefit them in the long run. And she teaches me that all the time. She's like, when you treatment plan, you need to think of what's best for the patient in the long run, not short term. So I really like that about her. It's always the patient that is at best interest, and there's no like like pushing me to like do something I'm uncomfortable with. And she always tells me, she's like, if you're uncomfortable doing something, like don't do it. So I love her, and it's just been a great experience so far.
I hope she watches the video and she loves you back.
Yeah, I'll share this video with her. We'll see.
Well, let me ask you, so in the real world, is practicing dentistry in the real world what you have expected? What are some of the best and not so good things about practicing in the real world?
Well, I guess a good thing is like I'm still kind of in the school mode, so I always feel like after I do something, like I'm like, oh, should I like show like like my mentor doctor if I should like go further, or if I should, if she thinks this looks okay. But like you don't have to if you're confident in your work. Like you don't have like I asked her and she's like, no, you don't have to show me, Um, but yeah, I think like the school mode, getting out of the school mode is like the most important thing. Being more confident as a clinician, because we all took boards, we all passed licensing exam. You have like the ability to be a good dentist. It's just, I guess, like the speed thing. I think this like I need to work on my speed, balancing like the different chairs. But that will come with time. So I think that's fine. But yes, real world dentistry is kind of what I expected, but then also kind of not what I expected. I know in school they always tell you like be conservative as possible, but if you keep thinking in that mode, you're never going to get anything done. I feel like you're just going to keep like running in loops. So if you see like a radiograph and the decay is pretty much at the nerve, it's at the nerve. But in school, like just be like, do caries control. And then you find out that day, like, oh crap, I got into the pulp. So I think that's like the biggest thing, just being confident in what you're seeing, and like just making sure you tell the patient, like, be sure when you tell them. Don't be like, oh, I think, probably, maybe, like those are bad words. You need to just be confident.
Now, having a few months of real world experience that you have right now, would you have done anything differently in dental school in order to achieve a higher or better success as to where you are right now in terms of treating patients?
Yes and no. I mean, I really wish COVID didn't happen, because like I was pretty much done with all my major requirements in dental school by the time like school like shut down in March. But I really wish I had those like couple months after to like see patients and still do stuff, because I planned on still doing things. So I think just losing that time really kind of messed things up. And in terms of like dentistry, like they do say that like if you haven't done it in like a few weeks, that you kind of like lose it. But I don't think that's true, because I think it's like a muscle memory. Like when I started drilling again, it was very surreal, but once I snapped out of it, like it came back so quickly. I was like, oh yeah, I got this. Like my very first procedure was a filling, and I went through it pretty quickly. And I've always been comfortable with fillings in terms of like, like just obviously like class ones are super easy, but then like class twos and threes always take a little longer, but I still feel pretty confident in those. But I definitely had to do a couple procedures before like I gained a little more confidence again. But I think the lost time was the most important like thing for me. And then I wish like maybe like on my rotations, sometimes like I did more versus like letting the residents step in because that's how you learn, you know. But other than that, it
Now,
was great.
now you must have heard that, with COVID, Tufts has limited its clinical capacity and even laid people off. Do you have any thoughts for the students that are right now at Tufts? Any advice for them?
Oh my goodness. My heart goes out to them. I mean, no one expected this to happen in 2020. I know our school is trying to work with, what they have. But also, I know students do feel like they're being cheated out of their education. But like, you have to like consider all these different factors. But all I can say is just get through this. It's definitely like it's a tough time right now. Just do as much as you can when you enter clinic. I know like a lot of students have been pairing up together. Like one's the provider, and one of the students is the assistant. But like I know a lot of students are scared. They're like, oh, we're not getting enough experience. But I would say just when you go into school, just do as much as you can. Um, that's all you can do at this point. And then I know like 25% of the class is only allowed to go on externship for the D21 class. So the ones who are able to go, they're very fortunate. But to those who aren't able to, don't lose hope and just be confident and try to get as much experience as possible when you are in school.
Now, one of the things that all students are always worried about is student loans and loan repayment.
Yes.
So I'm sure that's one of the concerns that you've always had. Does that keep you up at night?
Um, to be honest with you, not really. It doesn't keep me up at
Good.
night, but it is something I do worry about. I think like with dentistry, like if you committed yourself to to a school like Tufts, whose tuition is like really really high, you're definitely passionate about dentistry, and if you are, you just need to just stick with that passion. I mean, at the end of the day, like, yes, you do have to pay your loans off, but I feel like if you're passionate and you care about your patients, the numbers will follow. So I don't think you should be not sleeping at night, you know? I'm not saying don't work or like just settle for like just anything. You should definitely like negotiate your contract wherever you do get a contract with, but like I wouldn't sweat it. Just make sure like you're not screwing yourself at the end. Like basically like you'll know like what's a good amount or what's a decent amount in terms of your salary, but I wouldn't sweat about it. You'll pay it off in time.
With COVID, at least with our practice, the volume of patients that we've been seeing has, decreased. I wouldn't say significantly, but a good amount. How has that affected you in terms of your practice? I know you haven't practiced outside during COVID, besides, at the reservation, but that's still, real world dentistry. How has COVID affected your practice? And is that going to affect your ability to pay back your loans?
So our office is actually brand new. We opened 4 weeks ago. Yeah, we opened 4 weeks ago.
Congratulations.
Yeah, so it's been kind of like actually we're doing really well, but obviously we're not like at full capacity. Like we have flexible hours right now. We're open every other Saturday. I actually worked 6 days last week, but this week only five. We're just hustling to get patients in, and patients who have been coming in, they've been loving it, and I think people who really want to get their dental work, they'll come in no matter what. And we have we're taking all the safety measures, like we have social distancing in the lobby. I mean, we ask our patients to sit outside in their car, but if they can't, they can come in, but we make sure that they have a mask on. We take their temperature. We ask the COVID questions. We take our precautions, but I think overall, like it's not hindering patients from coming in our area. But also we are a new office too, so I don't know.
You've mentioned to me that the infection rate in where you are in Dallas is relatively high comparatively to other states.
Yeah.
How has that affected dentistry? And do you see it as, do you see it as a hindrance to this scratch practice that you guys have started?
To be honest with you, I really don't know. um, and in
Good answer.
Texas, yeah, in Texas, people like it doesn't seem like they're taking any social distancing measures. Hence, the numbers are high. Like everywhere I go, like you're supposed to wear masks. There's some people that don't even wear masks, and it's a state mandated requirement to wear a mask. So that just like worries me. I think right now a lot of people are kind of in denial in a way. They know it's there, but in denial, and they're just kind of moving on with their lives and just just doing their daily tasks, even though it's going around. I don't think it's really affecting our office that much, just because of how the Texas environment is, but maybe it'll change in the future.
Well, Ari, it sounds like you're doing very well. It seems like you're very, very grounded, but you've always been an exceptional student and you were always involved with ASDA. And everywhere I go, I used to see you. And it's unfortunate that I won't see you as often anymore. Do you have any, I'll see you in Texas someday, but do you have any parting words or any words of wisdom that could share with, the D21s? As they come out in terms of finding a job, anything, any pearls, that you could share?
Yeah, of course. Like, I think mentorship is the most important thing in dentistry. You need to have a good mentor. I know given the situation, you feel like you're not gaining a lot of like clinical experience right now, which is true. But the thing is, just because of that doesn't mean you have to automatically do a residency. I'm not pushing you to like work for a DSO or like, a private dentist, but you know what you want to do. But the thing is, don't worry too much, because as long as you find a good mentor, everything else will fall into place. I think that's like the biggest, like huge, like burden on them. Cause like I have D21 friends that constantly like call me and text me, and they're just like, dude, I don't know what to do. Like, should I do a GPR? Like, I planned on just working. Like, I don't know. And I'm like, go with your plan A. It's okay. Just find a great mentor. And that's possible. And I know, like I said, there's a lot of misconceptions about DSOs, but it's honestly like, if there's a good mentor that you can find, I'm not going to say they're all good mentors, but some people are just not good at teaching, but if you find someone that you vibe with really well and they're willing to teach you, like that is gold. So don't lose hope and everything will fall into place.
Well, it's always nice to hear a fresh face from dentistry that's only been operating for 4 weeks. You are definitely somebody that we should, have a conversation with in about 3 to 6 months. Because I'm sure the D21s, D22s, and so many others from so many different dental schools can benefit from your insight. So really appreciate your time and definitely looking forward to speaking to you again.
Thanks, Dr. A, for having me, and Dental Cupid.